The decision to actually move into two-sided risk is sort of a million-dollar question that people have asked themselves over the course of the last year or so. And really, there's several factors that you have to take into account and things that you can look at when you are trying to decide whether to move into two-sided risk or not. The two-sided risk model, like I mentioned, has a lower discount threshold. So what we call a discount is sort of the upfront cut that CMS takes. So in the upside only, it's a 4% cut. In the two-sided risk model, it's a 2.5% cut. So there's an advantage there. You might not think that 1.5% makes a difference, but it actually absolutely does. The other thing that's beneficial for the two-sided risk model is that there is an ability to qualify for the APM bonus, which is a plus for a lot of practices. And it also qualifies as a MIPS program, so they won't have to worry about that. So that in itself is actually a tremendous benefit. In terms of how do you decide if you're ready to move into a two-sided risk situation, when we work with our practices, we look at several different factors, right? We dive very deep into data. We look and see what their historical performance has been, and we trend it forward. So there's definitely some financial modeling and predictive analytics involved in terms of looking at possibility of success. And there is a stopgap as well, or a stop loss, as what CMS calls it. So we know what the absolute worst case scenarios are going to be. But there's several different things. The model itself is highly unpredictable in general. I mean, we have started to understand the model a lot better over the course of the last year or two, but there's a concept called volatility, not to get super in the weeds on this, but there's a concept called volatility, which is an unpredictable and uncontrollable aspect of the model. So that's really just who shows up at your door to get treated. You're not turning patients away. You're not being selective as to what type of cancer you're treating. So if you have, in one performance period, if you end up treating a high-cost cancer versus the next, there's no really gauging who's going to show up at your door or predicting that. So we have developed some statistical methodology to understand volatility a little bit better and be a little bit more predictive about it. But it's still a very, very big unknown and a question mark. So it really goes back to kind of answer your question is the risk tolerance. What is the worst case scenario? Financially, can the practice handle that? Do they have practice transformation down to a point where they're doing everything they can, right? Are there areas where they can improve? A lot of it is like I said, risk tolerance and not just of the practice, but of the individual physician as well. How willing are they to do what it needs to ensure that they're going to be successful in this model? So there's a lot that goes into it, but it's not a perfect formula or a definitive data analysis that can say, yes, you should do it, or no, you should do it. You can just sort of make a recommendation and a prediction of your success within a two-sided risk model.